Okay, so I just got this email 20 minutes ago from one of the states that I'm licensed in, talking about limiting PPE, which is personal protective equipment for hospital staff. Literally, I probably posted a video about the bra mask maybe an hour or so ago. And because I foresaw this coming, we were already rationing things out. So now they've issued a formal statement, guidelines as to how we use PPE and limiting our contact with patients so that we don't have to waste equipment. So some of the things that it says is that you want to minimize the number of times that you're going into a patient's room. If you, and then it classifies the different risk groups that you're in as a healthcare provider. If you're not in direct contact with the patient, then you're at low risk. If you're, provide some type of patient care with someone who is actually, been tested for it or tested positive for it, then you're at medium or high risk. And what I found to be a little bit just kind of disturbing and makes me nervous, because when I posted the bra mask, some people kind of laughed at it, but it wasn't funny to me because I know what we're up against, and I know that we're, as a healthcare professional, someone who sees people who are in those at-risk groups, I know that we can potentially expose other people to the disease, and people are dying. Some people who you don't necessarily think are ill or have comorbidities, they're passing away from the disease. So I know the importance of limiting our exposure and protecting ourselves so that we don't give it to other people. But what they're saying is, most people are hearing that they're saying, okay, if you think that you've been exposed, then quarantine yourself for 14 days. What it says in this statement is that if you are a healthcare worker, then you may go back to work with limitations if you've been exposed, if you're in the medium or high risk group. So essentially, if you're in the medium high risk group, you can go back to work in under 14 days with limitations, meaning, you need to be wearing a face mask and limit your contact with high risk patients, but you can still go to work. So, and we have to do what we have to do. We've signed up for this, as physicians. There are no snow days for us. We have to do what we have to do. And, but we all have to do our part, whether you are a healthcare provider or not. You have to limit your exposure. If you are a healthcare professional and you have kids, husband, wife, family members that you're in contact with, then we may be potentially exposing them to the disease. But we all have to do our part and protect each other, which is why I posted that video about the bra mask and also about, creating them for other people, because I saw this coming. I saw that we were already limiting it, but I also saw that people weren't necessarily sticking to the recommendations. They're still out and about, which means that the numbers will go up, our supplies will go down. So we have to do what we have to do. The bra mask was made out of necessity. So I encourage you, abide by these rules and recommendations. Stay at home. And, if you're at home, then, create a bra mask and donate, wash it, obviously, and donate it to other people. But, it's definitely a crisis. We're in a shortage. So like I said, numbers are going up, supplies are going down. So you all do the math. So it is not funny. It's definitely a state of crisis and something that should be taken seriously.